Iowa is one of the worst states in the country for access to safe pregnancy and reproductive care. According to the March of Dimes, one-third of Iowa's counties don't have a birthing hospital, birth center, or even an OBGYN. That means a lot of Iowans, especially in rural areas, have to drive more than 30 minutes just to deliver a baby. Some drive hours, and that's not just unfair or inconvenient, that's dangerous. And the outcomes are not good. Iowa has a 10.4 preterm birth rate, which means more babies are being born too early. These risks are even higher for people of color or those with lower incomes. How did we get here? Family planning in Iowa has taken a huge hit. According to the Guttmacher Institute, between 2018 and 2020, the number of clinics offering affordable reproductive care dropped by 12%. The number of patients served dropped by nearly half, and patients were 59% less likely to get the birth control they wanted. The so-called pro-life crowd thinks you're too stupid to put this together, but the 6-week abortion ban changed everything. On July 29th, 2024, Iowa's extreme 6-week abortion ban went into effect. 6 weeks is before most people even know that they're pregnant. After that, the number of abortions provided in Iowa dropped by 38%. And that's not because people stopped needing abortions, it's because they couldn't get them in time. Now people are being forced to stay pregnant against their will, or they're traveling hundreds of miles, spending thousands of dollars, and putting their health at risk, all for care that they should be able to get at home. Even if you're not seeking an abortion, Iowa's policies are hurting all forms of care. Fewer clinics are open. Fewer OBGYNs are working here. Telehealth and medication abortion are under attack. Medicaid and maternal care programs are being cut, and the clinics that are still open are stretched thin, overwhelmed, and underfunded. But I don't believe in abortion. That's okay. No one is forcing you to get one. But you don't get to decide for someone else, because let's be honest, you don't know someone else's situation. And it's none of your business. Because here's what the data is telling us. When abortion is harder to get, people face more delays. Unplanned pregnancies go way up. People lose trust in the healthcare system. Outcomes get worse, especially for people who are already struggling. Let's talk about what Iowa can do to reverse course. For starters, we need to elect leaders who protect care. We need people in office who will expand and fully fund Medicaid, protect prenatal, abortion, postpartum, and contraception care, reopen rural hospitals, and hire OBGYNs and midwives, invest in Title X clinics and telehealth abortion access, and end the bans that make care harder to get. We are all at risk because of careless anti-abortion policies. Where you live, how much money you make, or what kind of insurance you have shouldn't decide whether or not you get medical care. But right now in Iowa, it does. We can and must change that, because anyone can need an abortion. Anyone can need care, and nobody deserves to be punished for needing help.